We did the Heath Ledger toxicology case study. Here are some visuals of Heath Ledger, and also in the bottom left corner is one from when he was being carried out of his apartment following his death. Some facts about the case are, according to the New York Times, actor Heath Ledger was found dead Tuesday afternoon in a Manhattan apartment at the age of 28. The death was ruled an accidental from the abuse of prescription medications, specifically 6 kinds of painkillers, including sleeping pills and anti-anxiety drugs were found. Mr. Ledger was found dead in his rented Soho apartment on January 22nd when a masseuse tried and failed to awaken him for an appointment. Before calling 911, she placed 3 calls to the actress Mary Kay Olsen, who she knew was a friend of his. Ms. Olsen sent over private security agents who arrived at about the same time as the emergency medical personnel. Drugs involved. According to another New York Times article, the autopsy was performed the following day and the results were initially inconclusive. The drugs found in Ledger's system included diazepam, alprazolam, dioxylamine, lorazepam, and oxycodone. The medical examiner's office stated that it's the combination of the drugs that caused the problem, not necessarily too much of any particular drug, she said in the interview. All these drugs have a cumulative effect on the body.
Case resolution. In the wake of the medical examiner's findings, some physiatrists speculated on Wednesday that Mr. Ledger's use of prescription drugs had gone beyond abuse to addiction. There's a possibility that different physicians prescribed these medications, and there's a possibility that they were not misused, said Dr. Andrew Kawadi, Vice Chairman of Physiatry at Medical Center in Brooklyn. Sometimes patients try to take them as prescribed and there's an accidental overdose. I think that's unlikely. I think what's more likely is if someone dies of an overdose like this, that person was suffering from addiction. Heath was sick prior to his death, which explains the presence of all other drugs in his apartment. Assistance for forensic testing. Without forensics testing, we would have never been able to adequately determine the cause of death. They most likely use gas or liquid chromatography mass spectrometry. In other words, they took samples of Ledger's blood, urine, and maybe even his ventris humor and injected them into a machine which separates out each chemical and identifies them individually. From this, the machine was able to identify the chemicals, which provided the medical examiners and toxicologists with the adequate information to determine which drugs were the culprit of his death.